Parkinson's disease is, of course, common in older people and is important to diagnose, but often late to diagnose because it comes on so gradually. We think of Parkinson's in people who shake. Remember, it's a rest, not an action tremor in Parkinson's, but 1 in 3 people with Parkinson's don't shake, and it's often more difficult to make the diagnosis under those circumstances. Typically, it comes on very gradually, they're slowing down, they tend to have short-stepping, narrow-based gait, unlike the short-stepping, wide-based gait of cerebrovascular disease. One of the key points in Parkinson's is it's an asymmetrical or lateralized disorder. It shouldn't be the same on both sides, and generally they present with one side going wrong, and it's mostly the arm, not so much the leg. Most tremors are not caused by Parkinson's, I hope, because I have a tremor, and you can see it in my right hand. This is a tremor on action, a tremor on posture, so it is a benign essential tremor or a dystonic tremor. It is not, and I'm going to mimic this now, the rest tremor of Parkinson's disease. And I'm going a bit fast here because of my natural underlying tremors, a bit slower than that. However, tremor is not the hallmark of the diagnosis. The hallmark is slowness of movement or bradykinesia. What is bradykinesia? It's the sort of slowness you get in Parkinson's, so it's a circular description. But it's a thing which you can pick out quite easily as the patient walks in from the waiting room if you're thinking about it and looking for it. So when I get referred people over 65 who are not quite right, I often think, watch for the Parkinson's, and you can spot it when they walk in. What you expect to see is a slowness of movement as though they're a puppet with insufficient strings, or a cheap cartoon in which only one bit moves. So instead of fidgeting around like people do while they talk, they just sit still and only move their mouth. And when I'm doing this, I feel really uncomfortable already. I want to move about because fortunately I haven't got Parkinson's disease. What else do you expect to find? Remember to be looking very much at the hands, at the upper limbs, because that's where the symptoms and signs tend to be. So you would expect to see in a Parkinson's patient impairment of fine finger movement. So this is me being normal. If I have Parkinson's in my right hand, the left hand wibbles away, but the right hand just does that. The fingers move en bloc. You can then look for repetitive finger movements, and here's my hand without Parkinson's disease. Now I've got Parkinson's disease, and it arrests. I simply can't keep going with those movements. Cogwheel rigidity may be palpated with the patient at rest in a severe case, but in early Parkinson's you may need to bring it out by moving the other limb, contralateral synkinesis, and then you can feel the juddering in the wrist as though there's grit in the joint when the other limb moves. And it goes away when the other limb goes down. Cogwheel rigidity. And once you've felt that in an untreated Parkinson's patient, you don't forget it. It's very striking. And that's the diagnosis, unless they have physical signs that don't go with Parkinson's, such as dementia, falls, pyramidal signs like brisk reflexes or extensor plantars, or ataxia, cerebellar signs, including abnormal eye movements. There should be no ataxia, no cerebellar signs. There should be no pyramidal signs. The private parts, including sexual function, should work at least a little tiny bit, and there should be no memory loss, at least in the majority of patients. So the diagnosis hangs upon slowly progressive asymmetrical bradykinesia affecting predominantly the hand, sometimes with a rest tremor, and the absence of pyramidal, cognitive and cerebellar signs with private parts working fine.